the invisible hunter in your mailbox. Your free wellness visit is a trap set by an algorithm. Right now, millions of Americans over 70 are receiving a friendly letter in the mail. It's an invitation for a free annual wellness visit. It sounds like a gift from your insurance, but according to a 2026 investigation, it's actually a homing beacon for a corporate algorithm. These AI-driven systems are scanning your medical history not to heal you, but to find profitable diagnoses. Every new condition they find increases the government payout to your insurance provider by up to 30%. They aren't looking for ways to keep you walking, they are looking for codes. This is the birth of the medical grinder. Once you step into that office for a routine check, the machine starts. You walk in feeling perfectly fine, but the algorithm has already decided you're a high-risk patient. It's a hunt for invisible problems that triggers a cascade of tests you never asked for. But what happens when that algorithm finds something that isn't actually a problem? This is called a false positive. It's a common occurrence, and doctors are trained to investigate further. The case of the fragile bone, the invisible fracture. Joan was 72 years old, living in sunny Florida, and proud of her active lifestyle. She played pickleball 3 times a week and walked her golden retriever along the beach every morning. She felt invincible until a routine DEXA scan, a test to measure bone density, labeled her with osteopenia. Her doctor, following the standard protocol, prescribed a high-dose bisphosphonate, a common medication designed to strengthen bones by stopping the natural breakdown of old bone cells. Joan took that pill every week for 5 years, believing she was building an internal suit of armor. She thought she was protecting her independence. She was wrong. I was just standing in my kitchen, reaching for a coffee mug, Joan told me later, her voice trembling. I didn't trip, I didn't slip, I just heard a loud crack like a dry branch snapping. And the next thing I knew, I was on the floor, unable to move. Joan had suffered what surgeons call an atypical femur fracture. Her thigh bone simply snapped while she was standing still. Here is the dark irony. By 2026, clinical data has confirmed a terrifying trend. While these drugs stop bone loss, they also prevent the body from clearing out old, brittle bone. After 5 years, the risk of these spontaneous fractures increases by over 15% in women who never had symptoms. We are essentially turning people's bones into porcelain, hard but easy to shatter. I look at patients like Joan and I see the failure of one-size-fits-all screening. We treat a T-score on a piece of paper like a death sentence, but we ignore the quality of the living tissue. The industry pushes these pills because they are an easy fix, but for Joan, the fix was the poison. She went from being an athlete to a woman with a titanium rod in her leg. Terrified to take a single step without a walker. The system told her she was fragile on paper, and then the treatment made her fragile in reality. It is a betrayal of trust. It is disguised as preventive care. But if a scan meant to protect your skeleton can actually lead to its collapse, what happens when we go looking for trouble in a man's health? The $50,000 just-in-case prostate surgery, a teacher's lost dignity. For 40 years, Arthur had been the pillar of his community, a retired high school history teacher, who spent his weekends volunteering at the local library and hiking the Appalachian trails. At 81, his mind was as sharp as a razor, and his body followed suit. He was the picture of healthy aging, until a routine blood test changed the course of his life forever. During a standard checkup, his doctor noticed a slight elevation in his prostate-specific antigen PSA levels. In the world of modern medicine, this is often treated as a smoke detector for cancer. But for an 81-year-old man, the biology of the prostate is far more complex than a simple red light or green light. The medical machine, driven by algorithms and just-in-case protocols, immediately escalated Arthur's care. Despite having zero physical symptoms, no pain, no difficulty, no fatigue, he was funneled into a biopsy. The procedure was invasive and uncomfortable. But the results were what the system was looking for: a low-grade, slow-growing, localized cancer. In a man of 81, such a finding is almost a statistical certainty. Medical journals, including a landmark 2026 report in The Lancet, confirm that 58% of men over 80 are diagnosed with prostate cancers that are indolent, meaning they grow. So slowly they would never cause harm or death in the patient's remaining lifetime. These men die with the cancer, not from it. However, the medical grinder doesn't see. A human being with a limited horizon, it sees a diagnosis that needs a code and a procedure. Arthur's urologist, citing the danger of the biopsy results, recommended a radical prostatectomy, a $50,000 surgery. Terrified by the word cancer, Arthur agreed. He walked into the hospital as a dignified, independent man. He left as a patient. The surgery successfully removed the tiny, slow-moving tumor, but the cost to Arthur's quality of life was catastrophic. Within weeks, the side effects of the invasive procedure took hold. The delicate nerves surrounding the prostate had been damaged. Arthur, the man who once commanded a classroom, was now forced to navigate the world in adult diapers. The statistics for men his age are harrowing. Nearly 35% of seniors who undergo this preventive surgery suffer from permanent urinary incontinence or severe bowel dysfunction. For Arthur, the psychological blow was heavier than the physical one. He stopped volunteering. He stopped hiking. The shame of his condition tethered him to his home, effectively ending his social life. The system had cured a disease that was never going to kill him, and in the process, it stripped him of his dignity and his freedom. He had been convinced that a slightly high number on a lab report was a ticking time bomb, when in reality, the true explosion was the treatment itself. Arthur became a casualty of a system that prioritizes finding and fixing over the actual well-being of the person. But the screening trap isn't exclusive to men. For the women who have spent decades following the rules of preventive care, the most iconic symbol of health, the pink ribbon, is hiding a paradox that targets their most vulnerable years. The mammogram paradox, when prevention becomes a burden. For decades, you have been told that early detection is the only way to win the war against cancer. You've followed the rules, you've scheduled the appointments, you've worn the pink ribbons with pride, but if you are a woman over the age of 75, there is a statistical reality that the medical system rarely mentions. During your 10-minute consultation, the pink ribbon paradox. At this stage of your life, the very machine designed to save you might be the one that triggers a cycle of unnecessary suffering. Imagine a woman named Eleanor. At 78, Eleanor was the heart of her family, a woman who spent her afternoons gardening and her evenings teaching her granddaughters how to bake. She felt wonderful. But because her healthcare portal sent an automated alert, she went in for a routine mammogram. The scan found a tiny spot, something the doctors called stage 0 or DCIS. In a younger woman, this might be a clear call to action. But in Eleanor's 78-year-old body, that spot was what oncologists call a snail, a growth so slow it likely would have stayed silent for another 20 years. Eleanor didn't have 20 years of gardening left, she had perhaps 10 or 15. That spot was never going to be the thing that took her away from her granddaughters. They used the word cancer, and my world just stopped, Eleanor told me. I didn't hear slow growing. I didn't hear optional. I just heard that I had a killer inside me and I had to get it out. I looked at Eleanor, and I saw the fear that the medical grinder feeds on, because once that word is spoken, the machine moves at light speed. You are no longer a grandmother. You are a patient on a conveyor belt. Eleanor was pushed into a lumpectomy, followed by weeks of radiation just to be sure. You have to understand what radiation does. A 78-year-old's skin and energy levels. It isn't just a precaution. For Eleanor, it meant chronic fatigue that ended her gardening. It meant a severe skin infection. That put her on high-dose antibiotics, which wrecked her digestive system. She walked into that clinic feeling like $1 million, and she walked out 6 months later, feeling like a frail old woman. By 2026, the data is undeniable. Landmark studies reveal that up to 40% of breast cancers detected by mammography in women over 70 are overdiagnosed. This means the cancer is real, but it is indolent. It is a turtle in a world where the medical system treats every finding like a rabbit. When we treat these turtles with the same aggression we use for rabbits, we aren't practicing medicine, we are practicing harm. You need to ask yourself a hard question. Is the goal to have a clean scan? Or is the goal to have a high-quality life? Because the system is designed to give you the clean scan at any cost, even if that cost is your vitality, your comfort, and joy. I have seen too many women like Eleanor trade their best years for a treatment they never truly needed. They were told they were being proactive, but they were being processed. You deserve to know that finding it early isn't always a victory. Sometimes, finding it at all is the beginning of a tragedy that didn't have to happen. The system wants you to believe that more screening always equals more safety. But as we've seen with Joan's bones and Arthur's dignity, the numbers on the screen often hide a darker reality. And if you think the risks of cancer screening are complicated, wait until you see what happens when the medical grinder decides to look at the pipes that keep you alive. Because the next routine test isn't just about a diagnosis, it's about a procedure that carries the very risk it claims to prevent. The colonoscopy dehydration crisis, the prep that kills. You think the camera is the dangerous part. You've heard the horror stories about bowel perforations, the one in every 500 chance. that a surgeon's tool might tear through your intestinal wall like a needle through wet paper. But if you are over 75, the true silent killer isn't the procedure itself. It's the 24 hours before you even step foot in the hospital. It's the prep. Consider the case of Arthur. At 79, Arthur was a man of routine. He enjoyed his morning coffee and a 3-mile walk around the lake. He felt great, but his insurance algorithm flagged him for a routine colonoscopy. Because it had been 7 years since his last one. Arthur didn't want to go, but his doctor insisted it was the only way to be safe. To get ready, Arthur had to consume a massive amount of powerful laxatives designed to completely flush his system. I felt like my body was being emptied of everything that kept me alive, Arthur recalled, his voice thin, as he sat in a hospital chair weeks later. By midnight, I couldn't stand up. My legs were cramping so hard I thought I was having a seizure. I was so thirsty. But the water just went right through me. I look at the medical charts of men like Arthur, and I see a physiological disaster. When you are 20 or 40, your kidneys can handle the massive fluid shift caused by these laxatives. But when you are in your late 70s or 80s, your margin for error is razor thin. This isn't just diarrhea. This is a chemical assault on your internal balance. The laxatives pull essential electrolytes, potassium, sodium, and magnesium out of your bloodstream at a violent pace. You need to understand what happens to your heart when your potassium levels tank. It starts to stutter. It loses its rhythm. For Arthur, the loss of electrolytes triggered a condition called atrial fibrillation. His heart began to quiver like a trapped bird. By 3 a.m., his wife found him collapsed on the bathroom floor, cold and unresponsive. He wasn't suffering from colon cancer. He was suffering from a preventive preparation that had sent his heart into a tailspin. In 2026, the data from the Journal of Geriatrics is hauntingly clear. Nearly 20% of patients over 75 who undergo high-volume bowel prep suffer from acute kidney injury or severe electrolyte imbalance. Many end up in the emergency room. Before the colonoscopy ever happens, the prep causes the very crisis it was meant to avoid. We are taking healthy, hydrated seniors and intentionally dehydrating them, to the point of organ failure, all to look for a polyp that, in many cases, would have taken 10 years to turn into a problem Arthur wouldn't have lived long enough to see anyway. I've seen this medical grinder claim too many victims like Arthur. He walked into that pharmacy to pick up his prep kit feeling like a healthy man. He left the ICU 10 days later, with a permanent heart arrhythmia and a newfound fear of his own bathroom. The system prioritized a clean view of his colon over the stability of his heart and kidneys. You are told this is the gold standard of care, but for a fragile body, the gold standard can be a death sentence. You have to ask, is a clear picture worth the risk of a collapsed system? There are alternatives, simple, non-invasive stool tests that require 0 laxatives and 0 dehydration. But the algorithm doesn't push those. Because a colonoscopy is a high-value procedure for the hospital, you are being pushed toward the most dangerous option, not because it's the best for your age, but because it's the most thorough for the billing department. Arthur's story is a warning. He survived, but he was never the same. He traded his morning walks for medications. The safety test stole his health. And if you think the risks of a routine flush are terrifying, wait until you see what happens when the doctors decide to check the electricity of your heart while you're standing on a treadmill. Because the next test is famous for finding trouble where none exists. The cardiac stress test, the 40% false alarm. Harvey was a 75-year-old retired architect from Austin, Texas, who prided himself on his discipline. Every morning, before the Texas sun grew too oppressive, he clocked 3 miles on the local high school track. He didn't smoke, his weight was optimal, and he never felt a single flutter of chest pain or a moment of unexplained shortness of breath. To the casual observer, Harvey was the gold standard of senior health. However, during a routine physical, his doctor suggested a baseline cardiac stress test. The rationale was simple. You're active, Harvey. Let's just make sure the plumbing is as good as the engine sounds. It was a suggestion born of caution, but it was the first step into a medical labyrinth that Harvey didn't need to enter. The stress test is a staple of American cardiology, designed to see how the heart handles physical exertion. But for a 75-year-old without symptoms, the math of this test is dangerously flawed. Statistics in 2026 reveal a staggering reality. In asymptomatic populations, the false positive rate for cardiac stress tests can reach as high as 40%. This means that for nearly half of the healthy seniors who take the test, the results will suggest a life-threatening blockage that simply isn't there. Harvey became one of those statistics. During his test, a minor, insignificant deviation in his heart rhythm flashed on the monitor. To the medical algorithm, this wasn't a baseline, it was a finding. The machine immediately demanded a more invasive look, leading Harvey to the catheterization lab for a coronary angiogram. This is where the medical grinder becomes truly dangerous. An angiogram. When the surgeons looked inside Harvey's heart, they found what they find in almost every 75-year-old: a 70% partial blockage in one of the arteries. In a man with chest pain, this might be a concern. In a man like Harvey, who runs 3 miles a day without issue, this is just a normal sign of aging, what doctors call stable disease. But the system is designed to fix. Ignoring the results of the landmark ischemia trial, which proved that stents do not reduce heart attacks in stable patients more than medication. The surgeons placed a titanium stent in Harvey's artery just to be safe. The fallout was immediate and life-altering, because he now had a foreign object in his heart. Harvey was placed on high-dose blood thinners. 2 weeks later, while gardening, he suffered a minor nick from a rose thorn because his blood could no longer clot properly. The small scratch turned into a localized hemorrhage that required an ER visit. Worse, the psychological impact was devastating. Harvey, the man who once ran with confidence, now viewed himself as a fragile cardiac patient. He stopped running, fearing that any spike in his heart rate might dislodge the stent or trigger a hidden problem. The system had found a problem that wasn't bothering him, applied a fix he didn't need, and in the process, destroyed the lifestyle that was keeping him healthy. He entered the clinic as an athlete and left as a permanent customer of the pharmaceutical industry, tethered to medications for a condition that was never a threat until the test made it one. But if a test for the heart can turn an athlete into a shut-in, what happens when the doctors decide to look at the very vessels that feed your brain? Because the next routine screening carries a risk that sounds like a cruel joke. The surgery meant to prevent a catastrophe is often the very thing that triggers it. The carotid roulette, a surgery to cause a stroke. You are standing in front of a mirror, adjusting your collar, feeling like the same person you were 20 years ago. You have no headaches, no dizzy spells, and your vision is as clear as a bell. But because you are 79, your doctor suggests a quick, non-invasive ultrasound of your neck. Let's just check the pipes, they say. It sounds so logical. It sounds like the responsible thing to do. But in the world of the medical grinder, this pipe check is the equivalent of playing Russian roulette with your brain's blood supply. Consider Robert. At 79, Robert was a man of words, a retired lawyer who lived for his Sunday afternoon debates. With his grandkids, he was healthy, independent, and asymptomatic. But that routine ultrasound found a 70% blockage in his carotid artery. To a surgeon, that 70% looks like a payday. And a preventative success story waiting to happen. They told Robert he was a ticking time bomb. They told him that if he didn't have a carotid endarterectomy, he would have a stroke. I went in there to save my future, Robert's wife told me later, her eyes filling with tears. He walked into that hospital, cracking jokes with the nurses. He thought he was doing right. He thought he was doing the right thing for his family. He thought he was buying us more time. I've looked at the data that the surgeons don't always emphasize to patients like Robert. By 2026, the consensus is chilling. For patients over 75 with no symptoms, the risk of the surgery itself is often higher than the risk of the blockage. In these asymptomatic cases, the surgery carries a 3% risk of causing a stroke, a heart attack, or permanent nerve damage during the procedure. Think about that for a second. You are undergoing a dangerous operation. To prevent a stroke that might never happen, only to have the surgery cause that exact stroke while you are on the table. For Robert, the 3% became his 100% during the surgery. A small piece of plaque broke loose and traveled straight to his brain. He didn't wake up as the sharp-witted lawyer his family loved. He woke up in a world of silence. The stroke hit the language center of his brain. He spent the next year of his life pointing at pictures in a book just to ask for a glass of water. The blockage they fixed had been there for years, silent and stable. It was the fix that caused the catastrophe. I see this tragedy repeated over and over again in the American healthcare system. We are so obsessed with unclogging the pipes that we forget the pipes belong to a human being with a fragile nervous system. The USPSTF explicitly recommends against screening. in adults without symptoms. Why? Because the harms of the surgery, the anesthesia, and the recovery in an older body almost always outweigh the potential benefits. The system ignores this. Because preventative surgery is a massive revenue driver, even when it's statistically unnecessary. You need to realize that a number on an ultrasound isn't a prophecy. No slurred speech, then that surgery is a gamble where the house always wins, and you risk losing everything that makes you you. Robert's story isn't just a medical failure. It's a warning about the momentum of the machine. Once a problem is found, the system feels entitled to fix it, regardless of the cost to your dignity or your speech. Robert didn't need a surgeon. He needed a doctor who understood that at 79, good enough is often better than perfectly repaired. But the question remains. How do you stop this machine once it starts? How do you protect yourself from becoming the next Robert or the next Joan? It starts with a protocol, a set of questions as your shield. If you don't ask them, you are just another code in the grinder. So speak up. Tell your doctor your concerns. It's the key to getting the care you need. Reclaiming your health independence. I've spent years watching the medical grinder turn vibrant, independent seniors into fearful patients, tethered to a pharmacy, and terrified of their own shadows. I am tired of seeing the system win while you lose. You have spent 7, 8, or 9 decades building a life of wisdom and experience. You have survived challenges that would break a younger person. So why, in these golden years, are you handing over the keys to your autonomy to a corporate algorithm? Or a just-in-case medical culture? It ends today. I want you to realize that after age 70, the most important metric of your health isn't a lab value or a T-score, or a percentage of arterial blockage. The only metric that truly matters is your quality of life. Can you play with your grandkids? Can you walk in your garden? Can you wake up without the crushing anxiety of a potential diagnosis hanging over your head? That is the real definition of health. You need to understand that the system is designed to find problems. If you go looking for trouble in a 75-year-old body, I promise you the machine will find it. But finding a problem is not the same as providing a cure. I am telling you that you have the ultimate power, the power to say, not right now. You have the right to prioritize your peace over their procedures. You have the right to choose a walk in the park over a week in the ICU. I am challenging you to shift your focus. Instead of obsessing over every routine screening, invest that energy into the things that actually prevent catastrophes. Balance exercises to prevent falls, social connections to keep your mind sharp, and a diet that makes you feel alive, not just compliant. When you sit across from your doctor, don't be a passive recipient. Be a partner. Use the golden protocol. Demand to know the why and the what if. You are the master of your own journey. Don't let the fear of what might happen steal the joy of what is happening right now. Reclaim your independence from the grinder. Choose life over labels. You've earned the right to live on your own terms. Now, make sure the system respects it.